actually thank everyone here to have given me this opportunity to make a presentation of what we have been doing at Medanta. Okay, you will notice that my slide, the first slide, does not have any name because I do not take any claim of what is being said in the next few slides. This actually belongs to our institute, which had been bold enough to take a very, very strong step towards integrating Ayurveda into the modern medical system. Our hospital is very young, about 3.5 years old, but happens to be one of the largest hospitals in Asia. We have 1,250 beds. We have nearly 400 ICUs. We have every single specialty that you can think about other than obstetrics. Starting from robotic surgery to nuclear medicine to whatever you say, you have Ayurveda also there, equally placed in the whole system without any kind of segregation, considering it as an equal kind of a system, and that's what we have established. We think that we have established a culture in Medanta which many other institutes in India are trying to follow. We are actually trying to help everyone who is asking us help. Our next slide, please. I cannot go on without talking about my institute. As I said, this is the largest institute, single hospital in India. We are very big. 1,250 beds is quite huge. And since all the departments are there, one of the main things is that this hospital is run by a group of doctors. And if you walk into the hospital, one of the main things that you will notice is that the administration wing is in the lower ground floor. It's a statement. The administration of the hospital, including the financial aspect of the hospital, is in the lower ground floor, not in the top floor, or not in the 17th floor of the hospital, like any other, like you would see in many other corporate setups. It is administration and finance is not the first rung of priority. It is patient care that is the first rung of priority. In this particular group of set of slides, I am not going to explain about the clinical activities in detail, because there are many which I had been fortunate enough to be exposed and being able to deliver or try to deliver in this hospital. But I cannot go forward without acknowledging Dr. Trahan. Dr. Trahan had met me in 2006 when I was shifting from Bangalore to Delhi. He actually called me from Bangalore to Delhi. And one of the first things that he told me, and he had been echoing ever since, is that if we follow what we are following right now, which is the American way of establishing medical health care for the society, we will not be able to provide it, because the American system or even the European systems are collapsing, because we don't have enough money, we don't have enough resources, and we have more and more people. So if we are going to follow that health style, we are definitely bound to fail. We need to evolve a new style. We need to evolve a new culture. That's what he told me. He said that more than India, there are another 5 billion people, including Indians, out there in the world who can benefit out of this new system of medicine. And he believes that a new system of medicine, including modern medicine and Ayurveda, can evolve, and probably with the help of Ayurveda, and most probably from India. Of course, Professor Shundak here will definitely say that it is going to be from Germany, but I would say that it is from India, because I think we are very strong in Ayurveda here. Next slide, please. In the, Economist is a very, very valued weekly. Economist in April 2013 came out with a header or a lead article. The question was, can India become a great power? There are several things which are said under that, which says India lacks a strategic culture which hobbles its ambition to become a great force in the world. India is still widely seen as a near power that cannot quite get its act together. That India can become a great power is no doubt. The real question is whether it wants to. So I just try to remove the word India and try to replace it with Ayurveda. Can you go to the next slide, please? you see, you will see a great parallel there. We are very, no, the previous one, please. Previous one. Yeah, thanks. So we have a great parallel here between India and Ayurveda. You know, Ayurveda we lack a strategic culture, or we don't know how to place ourselves. We don't know how to push ourselves. We don't know how to make sure that our benefits are available to the community, so that the community comes back to us in large numbers. We don't know how to do that. Ayurveda is still widely seen as a nearly great medical science, but not have reached that. You know, it is not accepted by the community as a whole. If you look at the entire community, there is a large gap in what we perceive ourselves to be and what the community perceives ours to be. We are considered as a part of heritage. We are not considered as a part of the medical science. When are we going to be that? That was a question which came to my mind, and this echoed with what Dr. Trehan was telling me. So, next slide please. So I think that, therefore, all of us are caterpillars, and we have the ability to, we have the potential to become butterflies, beautiful butterflies, taking the honey from different flowers. Or, of course, we can go to the next slide please. We can be senior caterpillars, which many of us are trying to be. Like, I think we should stop being senior caterpillars. We should evolve into butterflies, and integrative medicine is one of the pathways for that. So I think I will take you to our next, through the next slides, I will tell you what we have been doing in Vedanta. So in integrative medicine, our first question was, why integrative medicine? I told you there are 5 billion people to benefit who has very little access to advanced medicine. We can reduce trauma, we can reduce cost, we can give improved healing, we can improve compliance, and we can improve outcome. Next slide please. So what is integrative medicine? So when we started working on this in 2006, the hospital got established in 2010. So there was a large period of thought process which went into what we were going to establish. So when we thought about what integrative medicine was, we understood that it is not something of what is integrative medicine, it is when is integrative medicine. Because integrative medicine is not something which you can say that, okay, this is integrative medicine, because this is, you can really show a part of what is integrative medicine, what is possibility of integrative medicine. But you can say when is integrative medicine. Integrative medicine is when non-medical sciences are utilized or not utilized together for the benefit of a patient based on the knowledge of their combined efficacy, its comparative benefits, economic viability, and practical possibility. There are several things which are part of this. Thus, integrative medicine is not a static goal to achieve, but a path to follow. Next slide please. And I think why we have been able to make a difference in Medanta, after thinking about it, after nearly 700 days, we made a report on 700th day of our department coming into existence. We came into existence in 2010 October 2. So after that, in October 2012, we made a report, and we did a strategic analysis of why we were better, because we needed to know that very clearly, because otherwise we will not be able to go forward. That was the reason. And when I say we were better, I mean that we were comparing ourselves with other hospitals or other kind of setups who had come out with integrative, medical possibilities. Let us say a huge establishment like CGHS, Central Government Health Services Scheme, has the Ayurveda here and the allopathy here, the homeopathy here, the Unani here, the Siddha here. Everyone's together sitting in the same roof, but no integration. We wouldn't call that integration, because if you call that integration, then you have not seen what is integration. So we wanted to know what was the difference. There were several private individuals and hospitals who had done that, but we were different. So we wanted to know. We wanted to know why we were different. And we think that there are 5 reasons for that. One is belief. The second one is co-location. The third one is attitude. The fourth one is freedom. And the fifth one is knowledge. I can explain. Next slide, please. Belief. If you take belief, I would tell in 2006 when I met Dr. Trehan, he was telling me with belief, with conviction, that integrative medicine is the way forward. And he wanted somebody like me he had employed me from 2006 doing nothing. There was no hospital for me to work on. He had made me run around, collect data, analyze it, talk to people, and then come back and discuss with groups and evolve ideas. So there was somebody who believed strongly, he was convinced, and that conviction made him to do things. And that kind of a belief, there are certain people who have that kind of a belief. And if you are going to start an integrative medicine department in any hospital, I would urge that you first of all meet the topmost person in that hospital or in the corporate and make sure that you make the change. Of course, Professor Shundak will vouch for me because he had been able to start a hospital with a neurology department because he has a good manager who agrees for that. Otherwise, it is not possible. So your management needs to believe that. You have to sell your belief to the manager. Then you can create evidences. Once you start getting into the establishment, you can create evidences. And these evidences can be case-based or evidence-based. You can get a diabetic neuropathic patient from a diabetologist, endocrinologist, refer to you, and you show some treatment, and patient goes back to the endocrinologist and say that your medicine had not been working, but the guy whom you had referred to me had cured my treatment. So then the diabetologist doesn't feel quite happy as long as you are part of his treatment program. You're not outside his hospital, you are not a threat to him, you are actually working along with you. So you have to create this kind of an environment, and for that you have to create evidences. That evidences should be believed. I'm so sorry. Okay. And then you have to go for co-location. I talked about co-location as a second point, but co-location you have to understand is how you locate different systems of medicine together, like in CGHS. But in our hospital, co-location means working from a very small place, but we are spread across. We work starting in all the 17 floors of the hospital. We work. It is not that we work from one single department in one single room, or we work from one single Panchakarma room or several Panchakarma rooms. Panchakarma rooms are there, our OPDs are there, but we work in every floor, from neurology to oncology to every department. We are allowed to work and we work. And the attitude is very important. Attitude of the doctor who is working along with you, the neurologist or the oncologist or whatever, or the modern medical practitioner, as well as the attitude of the person who is practicing there. You should be open-minded, accepting challenges, inquisitive, seeking new knowledge, accepting new knowledge. Next slide, please. And then comes freedom. Freedoms are different. There are different kinds of freedom. But I would come to the regulatory environment first, because regulatorily in India we are allowed to practice Ayurveda. So that's what I do in Medanta. I practice Ayurveda along with a modern medical practitioner. But there is no question asked because I am regulatorily allowed to practice in India. Clinical environment is the most important thing here. You have to have the freedom. You are not segregated as against in any particular manner. You have no constraint. You are free to work in any manner that you want, as any allopathic doctor is allowed to work in that hospital. That is the kind of freedom I had been offered, and I think it had a benefit. And then, of course, fifth one is knowledge. Shared knowledge of integrating medical sciences and techniques. And let us go to the next slide. Okay, there are three verticals for integrative medicine in Medanta. One is of clinical pathways, the second one is of new technologies, and the third one is of new drugs. I'll go to the next slide, please. We are very clear how we are going forward in clinical pathways. The aim of integration is to offer the best possible cure, care and management to the patient, nothing else. And stages of evolving integrative medicine are parallel care, where I start practicing without connecting to the allopathic doctor. Then there is complementary care, where I collect the data and go to the allopathic doctor and say, okay, you see, there are benefits for me. Sorry, I'll take only one moment. And then next one is the protocol. Once we show several treatments like that, then we will be able to show protocols. We have been able to do that. Next slide, please. What have we done till date? We have created 73 Ayurvedic clinical algorithms. There are clear-cut algorithms which we have created for 73 Ayurvedic diseases. We have 2 integrative medicine protocols. We have 16 complementary alternative medicine protocols and 4 data collection documentation processes, 14 outcome measures and trust build-up exercises. That is several of them. Next one. We use several outcome measures. None of them are new to us. We didn't create any one of them. We collected the simplest of them which we could utilize, which was available in the clinical practices across the globe. Next one, please. And these are the clinical areas where we work. In post-thoracotomy surgical pain, in minimally invasive thoracic surgery, radiation treatment for head and neck cancer, brainstem gliomas, post-chemo, radiotherapy, metastatic prostate cancer, breast cancer, ICU infection, ICU, early mobilization, prostatitis, sleep disorder, mouth ulcers, melasma, low back pain, Parkinson's, stroke, rehabilitation, rheumatoid arthritis, and idiopathic thrombocytopenia, infective bleeding disorders. Next one, please. Okay. We have 7 new drugs being developed. 2 of them are traditional drugs. We are working with CSIR in all the 7 of them, and we are in the process of, actually one of them is going into clinical trial, phase 1 clinical trial. Maybe ours is one of the only hospital which has a POCU setup, with 60 beds. We have an understanding with the Duke University where we can do proof of concept studies. So we are taking it. One of them is a Ayurvedic drug, typical Ayurvedic drug with 16 ingredients. Another one is a drug which is a chemically pure naturally occurring molecule. Next one, that's for cancer. We are looking at new technologies. I don't want to go into that. There are hurdles for integrative medicine. What I see as hurdles are lack of knowledge, experience and expertise, mindset of practitioners, mindset of the society. This is quite conditional. We are all told that integrative or the Ayurvedic system or the other systems of medicine other than modern medicine is not good, not believable. That is the way we are taught. So there is a mindset, there are regulations, and then fundamental differences among the integrating medical science. All these staying. What I want to say is that we should not forget that we should not be skeptical. We should believe that this is going to happen. Our doubts are traitors and makes us lose the good we oft might win by fearing to attempt. So we should attempt, and you should not fear change, because if you don't change, you don't improve, and constant change means you lead to perfection. So I would like to say that our limit is not the sky, it is ourselves. Thank you.